In the last couple of decades, the field of medicine has witnessed rapid advances that have proven to be of great benefit to patients in particular and mankind at large. Today, many diseases have either been completely eradicated, for example, smallpox, and many have been controlled, for example, leprosy. The growth in the field has also seen a surge in doctors specializing in various fields of medicine. Even within a specialty, there are a number of subspecialists. It is now not unusual to see a general surgeon specializing in just breast diseases or a urologist just doing transplant surgery or andrology. Specialty in a branch of medical science is done by medical graduate after completing medical school. Normally, it takes them another 3 to 5 years to qualify as a specialist in the chosen subject. Surgeons normally take longer than physicians to get trained and start a practice. Ignorance about which doctor one should see for a specific condition often means seeing the wrong doctor for the condition. These type of lapses delays and escalates the cost of treatment. In countries where there's lack of structured health delivery systems, where patients have to fend for themselves, it is extremely important for them to know a little bit on how the field of medicine operates and what does all these different medical fields mean to the public and the patients. You may call them simply doctors, but most doctors have extra expertise in one type of medicine or another. In fact, there are several hundred medical specialties and subspecialties. Here are the most common types of doctors you'll likely see. Anesthetist is a specialist who is responsible for keeping the patient anesthetized, sedated, and for monitoring the vital signs like airway, breathing and circulation during surgery. They monitor input and output during the surgery like delivery of intravenous fluids, blood and other drugs. Decision on type of anesthesia before surgery can be discussed with them. A neurologist is a physician dealing in disorders of the brain and nervous system. He diagnoses and treats neurological disorders and diseases. His surgical contemporary is called a neurosurgeon. They generally treat conditions such as meningitis, encephalitis, dementia, epilepsy, headache, Parkinson and movement disorders, or sleep disorders, congenital disorders, multiple sclerosis and poliomyelitis. An oncologist is a specialist dealing with treatment of cancer and uses chemotherapy drugs to treat the disease. Their surgical counterpart is called surgical oncologist. They are trained to treat different kinds of cancer and first work as an assistant under an experienced oncologist. A pediatrician treats children with medical conditions. They focus on the prevention, detection and management of physical, behavioral, developmental and social problems that affect children from birth up to 16 years of age. They work to diagnose and treat infections, injuries and many types of organic disease and dysfunction and bring about improvement in the life of children with chronic problems. A general practitioner treats many different medical conditions and ailments on an outpatient basis. They are popularly known as a GP or a family physician in many countries. Normally, it is good to identify and register with a GP in the area in which you live. It is a good practice to consult a general practitioner before getting referred to a specialist. General practitioners do not specialize in one organ of the body, but have a good knowledge of a wide range of medical conditions and complaints. They also offer health education and educate their patients about the preventative care measures along with treating both acute and chronic medical ailments. Their patients may be of all age groups. They will normally handle child immunization and may also be capable of doing minor surgical procedures. A gastroenterologist is mainly concerned about the prevention, diagnosis and treatment of conditions and disorders in the gastrointestinal tract involving the esophagus, stomach, small and large intestine, rectum, liver and pancreas of adults. They look into troubles of swallowing, heartburn, chest pain not related to the heart, digestive and elimination problems and certain conditions occurring after surgery. Besides, they can use endoscopes to screen for ulcers or cancers in the stomach or colon cancer and effect removal of polyps too. A gastroenterologist may, in certain conditions, work along with your general practitioner for the cure of a condition or disorder. Geriatrician focuses on healthcare of elderly people, generally patients who are over 65 years. The term geriatrics comes from the Greek gamma rho omega nu geron meaning old man, and iatros meaning healer. This specialist is gaining importance as the number of people who live over 65 is increasing in most countries. Geriatrician at times requires to take an interdisciplinary approach to a problem, as many patients suffer from not only medical but social problems too. A geriatrician may work with other physicians, nurses, social workers, occupational therapists and family members to take care of the needs of his patient. A cardiologist is a specialist who is an expert in treating the heart and the associated cardiovascular system. He may collaborate with cardiac surgeons to decide the course of treatment for his patients. Cardiology is a specialty which has many subspecialties like interventional cardiology, nuclear cardiology, electrophysiology, or echocardiography, which help in making diagnostic studies. In addition, one could specialize in medical or surgical procedures and become a cardiac physician or surgeon. Cardiologists play a very important role and have to be cautious as they deal with the most important part of the human body, the heart. An endocrinologist is a specialist who diagnoses and treats diseases like diabetes, thyroid diseases, metabolic disorders, over or underproduction of hormones, menopause, osteoporosis, hypertension, cholesterol disorders, infertility, etc. An endocrinologist could be a diabetologist, dealing in pancreas that produces insulin. These specialists carry on research to learn and treat patients with hormone imbalances. They treat diabetics so that they are able to avoid other complications like problems of the eyes, kidneys and nerves leading to blindness, dialysis, or amputation. A rheumatologist is a medical practitioner who specializes in treating arthritis, rheumatic diseases and conditions involving the bone, joints and muscles. They carry on research regarding these disabling and fatal conditions and can suggest appropriate treatment. A nephrologist is a medical doctor who specializes in kidney care and in treating kidney diseases. He usually sees patients referred to him by general practitioners having kidney-related problems, high blood pressure and other metabolic disorders. Nephrologists have to undergo specialized training in kidney diseases and disorders. You would find nephrologists commonly treating chronic kidney disease, polycystic kidney disease, acute renal failure, kidney stones, high blood pressure. Nephrologists play a managerial role in dialysis centers by setting up policies and procedures for dialysis treatment. Psychiatrist is a physician who specializes in the diseases and disorders of the mind. Helps to enhance the quality of a person's life by making assessments of the mind and emotions, providing treatment and rehabilitation care to mentally disturbed. These specialized doctors help patients with psychiatric or mental disorders to prevent, reduce and eliminate symptoms and disabilities that arise as a result of such disorders. Specialists in psychiatry are well informed and skilled in the integration of medicine, psychiatry, neurosciences and psychosocial sciences. They may also deal with phobias of all types. A dermatologist is a medical expert who can be consulted for skin, nail and hair diseases and disorders. Dermatology deals with not only study, research and diagnosis of normal disorders, diseases, cancers, cosmetic and aging condition of the skin, hair and nails, but also includes specializations like dermatohistopathology and topical. It also includes dermatological cosmetic surgery, immunotherapy, laser therapy, radiotherapy and photodynamic therapy. Venereologists deal with the study and treatment of sexually transmitted diseases caused by sexual contact. Venereologists may be active medical practitioners or may be engaged in research working out methods of prevention and innovations in treatment. A visit to the venereologist is recommended for those suffering from drug resistance and for long-term management of sexual infections. A radiologist is a physician who reads and interprets diagnostic imaging pictures, mammograms, CT scans, MRI and ultrasound images. After due specialization in nuclear medicine, radiation therapy, MRI, CT, neuroradiology or pediatric, skeletal, genitourinary, or gastrointestinal radiology or mammograms, they may deal in specialized fields. Radiation physicists, radiation biologists, radiological administrators and radiological technologists assist radiologists. A diabetologist is a healthcare professional who specializes in the clinical study, diagnosis and treatment of diabetes, which is a metabolic disorder and, therefore, forms a part of endocrinology. A gerontologist is a doctor studying and treating conditions arising in the aging process. He mostly works with senior citizens, studying their biological, medical and social issues at that age. These specialists work in hospitals, nursing homes and laboratories and may form a part of government health policies for the old. A gerontologist is a licensed physician and diagnoses and treats old age diseases like Alzheimer's disease, Parkinson's disease and osteoporosis. A neonatologist is a specialist in caring for premature and ill newborns and generally works in hospitals' neonatal care or baby special care units. This specialist does tests to make sure that newborn babies are well developed and free from infections and organ deformities. After delivery, they may keep infants in hospitals to avoid chances of infection and speedy recovery, but have to also make sure the infants are intellectually stimulated, bond with the parents and provided with suitable nutrition in the pediatrics. A hepatologist is a specialist who is a gastroenterologist dealing in liver diseases and disorders. He deals in disorders like serious and chronic hepatitis, chronic alcoholism and liver disorders due to certain medications. It is a well-known fact that the stopping of the function of the liver or its ill-functioning can lead to slowing down of metabolism, protein production and may lead to the ultimate toxification of the body. A hepatologist is consulted for his up-to-date knowledge of medication and treatment of liver diseases and disorders. An internal medicine practitioner deals with the diagnosis, management and non-surgical treatment of unusual and serious diseases. In modern times, internal medicine specialists have started specializing in one organ or a particular area of medical knowledge like gastroenterologists, stomach, and nephrologists, kidney. Nuclear medicine practitioner or technologist is a professional who is trained and experienced in the theory and practice of nuclear medicine procedures that involve the use of small amounts of radioactive materials or tracers that is administered by injection, swallowing, or inhalation to diagnose and treat a variety of diseases. Nuclear medicine practitioners carry on bone scans to examine orthopedic injuries, fractures, tumors, or unexplained bone pain, and heart scans to identify normal or abnormal blood flow to the heart muscle, measure heart function.